Our first herb is called shepherd's purse. We consider that, or it's subtitled the internal bleeding healer. So the format is basically as follows. One, where is it found? All of the herbs that I will cover are native to the US. Maybe different parts of the United States, but native to the United States. We're not talking about Chinese herbs and herbs from East India, the Honduras, or some exotic place. We're not doing that. You will also get the botanical name. The botanical name ensures that you are getting the right herb, the right medicinal herb. All the herbs that I will share are medicinal. All species or variations of that herb are not necessarily medicinal. We'll cover the part of the plant that's used. That could be the flower, the leaves, the root, etc. Sometimes it's only the root. Sometimes it's all of the plant. That will make that distinction. Time of year collected, you don't have to memorize that. However, why is that important? How might you reference that? In terms of when you see it, some plants, and then if any of you have done gardening or anything, you may realize that some plants present early in the spring. You have dandelion and shepherd's purse and such that come up in the spring. Some present in the fall or various times of year. Some all year, depending on the climate. And then we'll talk about the benefits as well. Okay, so shepherd's purse, found all over the United States. Capsella bursa pastoris is its botanical name. That is Latin. It may be called other things in various places, but the botanical or Latin name is universal. So whether you're here or Italy or Germany or Austria or whatever, the botanical name remains the same. And then its time of year is collected April through September. Some will have very long period of time that you can harvest it. Others will be shorter or restricted periods of time. Benefits: internal hemorrhages after childbirth with bloody urine, bleeding from the lungs, bleeding from the stomach, profuse menstruation, nosebleeds, wounds, cuts, earache. Okay, so those are the applications. You can see why it's called the internal bleeding healer. It could be internal and external bleeding healer, but you can see it relates a lot to bleeding and stopping bleeding. The application is as an infusion. If that's the first time you've heard that, infusion and tea are synonymous. Commonly, people say tea. Herbalists say infusion. But shepherd's purse can be used as an infusion, as an ointment, a poultice, or what we call emergency field use. You'll see that term from time to time. What is emergency field use? Emergency field use means you're out camping. There are no hospitals or clinics or anything around, and you need something and you need it right away. You can do something. That's kind of your first aid in the field. It's what we did as Cub Scouts and Boy Scouts and what they may do in the military and other emergency applications where you got to do something right away, and you don't have bandages available. You don't necessarily have a first aid kit. It's good. Some people would call this something that you'd have in your survival kit. Okay, and then now the medicinal properties. I'm going to name the medicinal properties, and then I'll give you more information on their meanings. And incidentally, the medicinal properties and how they're categorized and how they're categorized as herbs and how drugs are categorized are, I would say, probably 95%, if not more, the same. Hemostatic, stops blood. Mild astringent, probably heard of astringents. Diuretic, anti-hemorrhagic, and mild stimulant. Don't worry about memorizing these now. You'll get reference, definition, etc. And the more you hear it, the more it'll make sense, and you'll be able to correlate it to the benefits. So the benefits, when it says internal hemorrhages and it says anti-hemorrhagic, oh, it stops bleeding, it stops hemorrhaging, which is bleeding. Okay. Or hemostatic, bloody urine, stops the blood in the urine, or bleeding in lungs, or bleeding in the stomach. Those types of things. Are profuse menstruation or nosebleeds. Hemostatic, stopping blood or slowing down the flow of blood. All right. Next, we go to next slide, medicinal uses and preparation methods of shepherd's purse. You see different colors here that correlate to the different ways or different applications. So to be clear, on the right on your screen, when it says this is what it's for, all types of internal hemorrhages after childbirth, bloody urine, bleeding from the lungs, bleeding from the stomach, profuse menstruation, or dropsy, which is edema, swelling, or nosebleeds, you can use the shepherd's purse as an infusion. And you know what infusion is. It's a tea. And then it's the preparation method. Pour 12 ounces of boiling water over 1 ounce of the fresh green plant. Steep for 30 minutes. Cool and drink. Dosage, a wine glass full. So it tells you how much to take, how often you take it. QID. QID stands for 4 times a day. That is a Latin term, quarter in D. Okay, 4 times a day. Note, use half if dried plant is used. So you see the application, you see the method that you use it for those conditions. Okay. And then next, for nosebleeds, cuts, wounds, and earache, shepherd's purse can be used as an ointment. How would you prepare the ointment? How do you prepare an ointment? Use 8 ounces of the fresh plant and 16 ounces of the ointment base. We'll go over what ointment bases are, the choices you have for ointment bases. You beat the plant into a pulp and add base. Heat until the moisture evaporates, strain and place in a jar. So again, you have the condition, you have the application method, or how you would apply what, do you use a tea, a tincture, an extract, an ointment, etc. Now, for diarrhea, dysentery, coughs, bleeding lungs, internal pains and bruises, leukorrhea, broken or crushed bones, fluid extract. Okay, that's what we talk about, the extraction process. So tea, tinctures, those types of things. Prepare it as a fluid extract. There's a standard method of doing that. Don't worry, we'll cover that. The dosage, 1.5 to 2 drachms of drops in warm water. A drachm is 1/8 of a fluid ounce. Okay. So how much, how you use it, for what conditions. All right. And then that takes us to shepherd's purse. As an external wound preparation method, as used as follows: a poultice. Now, poultice is a special preparation method. Don't worry if you haven't heard of poultice before, but you crush the leaves, mix it with hot water, cover with a cloth, keep it moist and warm. That's when you place it on the body. Okay. So poultice is a kind of a special preparation method. You use poultices externally. So we got internal applications and external application. Next, we have comfrey. On the right, you see a picture of what comfrey may look like in nature. Comfrey, the bone mender, also known as the bone mender, botanical name is Symphytum officinale. Where is it found? Also found all over the United States. Part of the plant is used all parts. Time of year collected April through September as well. Benefits diarrhea, dysentery, cough, bleeding lungs, internal pains and bruises, leukorrhea, broken or crushed bones. Application, infusion, decoction, poultice, or fluid extract, and medicinal properties as a demulcent, vulnerary, pectoral, or astringent. So how does that work? What do we do with this bone mender? Again, these are the application. These are the conditions at the top. And it's pretty much the same, very close, if not the same, on the top. And now the comfrey can be used as an infusion, a decoction, or as a fluid extract. What's the difference? An infusion is a tea. Okay, so how do you make a tea? With water. So you prepare the leaves and stems in a standard infusion, steep for 20 minutes, cool and strain. So teas, you normally will steep those 20 to 30 minutes. Not microwave it, not boiling it. You use herbs, sometimes fresh, sometimes dried. A little different in terms of amounts, whether it's fresh or dry. And then you cool and strain. So the proper way to make a tea or an infusion is to have the dried or the fresh herb in a container, and then you pour the, for example, the boiling water on top of it, or you bring it up to boil. We'll get more into the specifics of the preparation methods as well, and more demonstration on that, so you can kind of visually see it and understand that as well. So dosage, take frequently in wine glass full amounts every 2 to 3 hours if you're going to use comfrey as a tea. As a decoction, prepare a standard decoction, boil 20 minutes in water, or melt, cool, and strain. Take frequently in wine glass full amounts every 2 to 3 hours. I'll make a distinction right now, and I'll come back to this as well. You'll find that I will reiterate and reinforce it. I find that that's how I learn, how other people learn. Difference between an infusion and a decoction is the part of the plant that's used, and then how it is prepared. So, for example, with an infusion, you're using the softer part of the plant, the flowers, the leaves, typically, for example. So for decoction, you may prepare the decoction from the root, stems, the bark, the harder part of the plant. Therefore, we're boiling it. In a infusion or tea, we're not boiling it. With a decoction, because it's a harder part of the plant, we do boil it. Now, and then when it comes to, again, same conditions, diarrhea, dysentery, coughs, bleeding lungs, etc. If we're going to use it as a fluid extract, there's a standard method of making a fluid extract. And as was alluded to earlier, how do you make an extract? So you can take a part of the plant. It could be fresh, it could be dried, it could be depending on what it is. Typically, we use alcohol as within the extraction process, and it sits in there and soaks and extracts the medicine from it, and then you're taking that by drops. So you're taking wine glassfuls in the case of infusion or decoction, or drops when it comes to the concentrate. All right. And don't worry if you got a little question mark above your head. It gets clearer and clearer as we go along and reiterate that. Mullein. And you may have seen this in your, hello. You may have seen this in your yard or in nature. Okay. You see these mullein plants there? You see my arrow there? Yes. Okay. That's mullein. That's actually second year mullein. First year it's close to the ground. Second year it sprouts up like this. Okay. Now mullein, or some people will say mullein. Okay. And then that's a stage, mullein in the stage. That might be first year mullein. It's close to the ground there. Verbascum thapsus, found in the western part of the United States. You'll see that in Michigan and some other places as well. But it may be more native to the western part of the United States. We use the leaves, the flowers, and the roots. Those are parts of plants that are medicinal and that are used. It's collected July through August, or July and August. Okay. It's not presenting in the spring as much as it is summer. Mullein, dock, blanket, herb, shepherd's staff, Adam's flannel are some other names that it may be called. But again, you want to get the Verbascum thapsus and know that this is a botanical name. Benefits: dysuria, cystitis, amenorrhea, mastitis, bronchitis, asthma, ringworm, bactericide. Don't worry about memorizing those. Application: infusion, decoction, powder, or oil. Those are another couple of preparation methods. Medicinal properties: as a demulcent, emollient, astringent, anodyne, expector, or and slightly sedative. Okay, this is mullein. For medicinal uses and preparations, for dysuria, cystitis, amenorrhea, mastitis, bronchitis, asthma, you can use it as an infusion or tea. For some of the same conditions, as a decoction. For ringworm, it is a bactericide, a powder. So you've got about 4 or 5 preparation methods: infusion, which is our tea, and made from the fresh plant or dried plant; decoction, which is made from the harder part of the plant, like the roots, the bark, or the stems; and powder. That's when you take the dried plant and break it down into a powder. You may make that into a paste. In some cases, it'll be powdered and put into capsules. You've seen, of course, we've all seen powders in capsules, or it may be sprinkled on, or on something else, but it made into a powder. For ringworm and bactericide, grind the plant into a powder, mix with honey, make a paste, and apply freely, or apply to the infected area. That's mullein. Mullein is really well known for respiratory conditions. It's probably best known for respiratory conditions. In fact, I got a little mullein here as a cough syrup, quite efficacious. Okay. Mullein. It can also be used for earaches, for mumps, and as a bactericide. Here's oil of mullein. Now, I'm going to call attention to this. This is a special preparation. You will not readily see this or hear. There are some things that will be covered in this class. You won't. It's not that common. This is drawback to some older preparation methods and applications. Remove the flowers from the stem, place in a small container of olive oil, soak it. Now, if you see macerate and soak is the same thing. for 3 weeks in warm sunlight or near a warm stove. So in some cases, if you're using herbs and you want to make it into an oil, you'll take that herb, put it into oil, and give it. Now would be considered more of a gentle heat. Okay, so 3 weeks in warm sunlight is allowing nature to extract the medicinal benefits from that herb and infuse it into the oil, and then you use it. Now, there's a second way to make the oil of mullein. That's removing the flowers from the stem. That's the part we're using. Place it in a tightly corked clear glass jar. Hang the bottle in the sun for 4 weeks. The oil from the flower will have been instilled. That's called installation, or instilling the herb into the oil. Okay. And then you can add 10% alcohol to the mix as well, and have 2 or 3 drops in aching, or what they would call purulent ear. So that's for earache. Oil of mullein, and again, you may not see that online or in a health food store. Respiratory combinations. Equal parts of mullein and lobelia aids bronchitis and asthma. Bronchitis and asthma are very common. Very common. So mullein and lobelia are both considered herbs that are good for the respiratory system, or they benefit the respiratory system. So prepare that as a standard infusion. Mullein, lobelia, put them together. Tea. Drink that, give that to the person who is experiencing the respiratory challenge. Okay. And they would say that's preferential to using a medication or something else that could have other side effects that are unwanted. Then we have garlic, which is known as the bad germ fighter. So why they call it the bad germ fighter? Because in the body, you have what you call beneficial beneficial bacteria, or friendly bacteria and unfriendly bacteria. Okay? Friendly and unfriendly bacteria. So since both exist in the body and they, in a healthy state, they're going to be in balance, right? Because they have different roles. And if you have enough of the beneficial bacteria, that balances out if you have enough friendly bacteria or beneficial bacteria, that balances out the unfriendly bacteria. If they get out of balance, where you have more unfriendly or bad germs, then that's when a person typically gets sick. So what system of the body are we speaking about? The immune system. And the garlic is known for addressing those germs and viruses and etc. Allium sativum is its botanical name. Found all over the United States, and you can plant it, and people planting in the fall, they'll be planting it. If they haven't planted already, they will be planting it soon, and looking for it to come up next year. Part of the plant that's used, the flower, stems, and bulb. Time of year collected, September, October. Okay, so they're collecting, and then I'll be doing some planting as well. Okay. Benefits: infections or suppurations, oozing and such. It can be used as an ointment, an oil, plant juice, or syrup. Okay, so here's another couple of preparation methods. Plant juice and syrup. You probably have never heard of, unless you've been in this class, you probably never heard of a garlic plant juice or a garlic syrup. Okay. Ever hear about that in the island? Yeah. Okay. Some of you may have heard about it in the islands or other places. Okay. Medicinal properties is antiseptic, antispasmodic, diaphoretic, and expectorant. Garlic, powerful stuff. Medicinal uses and preparations for infections and suppurations. Make it as an ointment. Express the juice, or so you got a garlic press or something, and you're expressing the juice from 3 or 4 bulbs, mixing it with 1 pound. Now I know it says lard here. It's just a traditional recipe. I am not advocating for lard. There are other mediums that you can mix with the juice with. Rub it on chest and throat as needed. Now, somebody had a mother, grandmother, or auntie, or somebody in the community. They might have rubbed you down with with preparation like this, or goose grease or something. It doesn't happen as much here. It says or mix with Vaseline. I don't advocate for petroleum products. I'm just sharing the traditional recipe. And you can also rub this on the bottom of the feet. Having garlic juice, having some herbs on the bottom of the feet are good ways and uncommon ways of getting medicines, herbs, and preparations into the body as well. The feet are quite absorbent. The palms of the hand are absorbent. The bottoms of the feet are absorbent. Sometimes people put onions or garlic or some things in socks or wrap it around the bottom of the feet. Now, they don't do that much anymore, especially with the advent of drugs. Oh, that's old. Those are old wives' tales. People don't do that. What? You putting an onion on the bottom of your feet, putting garlic on there? Where do you get that stuff from? Crushing that stuff up? Oh, that old time stuff, that stuff stinks, and I ain't putting that in my socks, whatever. But guess what? It worked. It worked. It's expensive. It's accessible. People pass it. If you pass along from generation to generation, people can do that. Because overuse of antibiotic overuse is a major problem. That's a lecture for another time. But we don't want to overuse antibiotics. We don't want babies to start off taking antibiotics, and then later on in life, their immune systems are compromised. We don't want our adults, immune system compromised. For rheumatic pains, joint pain and such, oil of garlic, that's a special preparation. Again, this is some stuff that you won't readily come across in many books. Grate and bruise the garlic cloves. Place to a depth of 1 inch in 1 quart container or a jar. Cover it with fresh, pure olive oil. Place in the sun or warm place for 3 full days. Okay, not weeks, but just days. Strain in bottle, store in a cool place, dosage as needed. Oil of garlic. Guess what? This time, certain times of the year, lots of colds, lots of flus. People want, oh my goodness, do I need to take a vaccination? Do I need to take I'm not going to tell anybody whether to take a vaccination or drugs or whatever. I'm never going to tell a person not to follow their doctor's advice or not to consult with their doctor. But I'll say consult with your doctor. However, what our mama and grandmama and great-grandmama and them used to do, and what they do in some countries and some places that have better health than we do, even though we spend more on healthcare, is many of them are doing natural methods. Some people have a poor reaction to certain drugs and understand this long-term challenges. So there's something else. Grate and bruise the garlic cloves and let that soak and say, oh, some of my students have done that. They made me a nice olive oil and garlic recipe. You put it in a nice bottle. Beautiful. Oh, thank you. Okay. And so sometimes just taking a little bit of that regularly. So you're not worried about burping and being on your breath or coming through your skin. So sometimes they'll come through your skin, but that means that it's getting deep into your tissues. It's permeating your body. It's all in the digestive system, is going all throughout. Okay. And if it doesn't prevent you from getting colds and flus and illnesses and the challenges and the heebie-jeebies and all that, it may shorten the duration. And sometimes what you'll notice first is that whatever the challenges that you normally would have gone through, it shortens the duration. So let's say the average person will have a flu or let's say a cold, and it'll be 7 to 10 days. They may start on some natural preparations, and they may say, you know, well, I still got sick, but it only lasted like 3 days. So sometimes the indicator is that your illness will be less severe or shorter duration or both. Okay. Now we have some other medicinal uses: asthma, whooping cough, bronchitis. Then we have the plant juice. Again, something that few of us probably heard about. And that is 1 part of it is the express juice with 2 parts of distilled water. Apply mixture with cotton swab to an infected sore or wound. So here you got some really powerful medicine that for probably less than $1, you've got a preparation. Now again, asthma, whooping cough, bronchitis, or even an infected sore or wound. Internal application, external application. All righty then. Now, then we get to garlic medicinal applications for asthma, cough, bronchitis, strep throat. So we know that the garlic has antiseptic properties, right? Look at this: asthma, cough, bronchitis, strep throat. What is that? What system is that? That's our respiratory system. So we got the syrup of the juice special preparation, where you pour 1 quart of boiling water on a pound of sliced garlic bulbs, steep for 12 hours. Wow. You're going to steep that for 12 hours. You're going to let that sit in there for 12 hours. Then you strain it. Add sugar or honey or something to make the consistency of a syrup. And bruise or boil caraway or sweet fennel seeds in vinegar will mask the unpleasant smell of the garlic. One of the biggest problem people have, or resistance to using the garlic, is like, oh, this smells so much. And guess what? This stuff could save your life. It could save you from suffering. Used for coughs or asthma as needed. Then we don't skip ahead too far. Red clover, the blood purifier. Okay. Its botanical name, Trifolium pratense. It's found all over the United States, and you'll see it in the spring. The blossom is what's used. Other parts of this plant can be used, but like the clover, but the blossom is used, collected May through August. Pretty long season there. Benefits mental stress. So it calms the nerves, purifies the blood, and it can be beneficial for whooping cough historically. Can make it in an infusion of tea, syrup. Its medicinal properties: antispasmodic, calms spasms. It's a demulcent, sedative, antiossive, and alterative. Okay. And how are we using it to relieve mental stress, purifying the blood, and whooping cough? More people should be, or can definitely benefit from making some red clover tea. People who like to wildcraft will go places in the neighborhood where they don't spray with pesticides and chemicals, not too close to the roads and such, and will collect that red clover. Unless you need to get it. Well, I might. Can you get it organic? You can get it in store. You can send off for it. You can purchase it, but some people will harvest it. You know, um, in fields and such as an infusion. Drink it as a standard infusion. It says take freely, wine glass doses, or syrup is special preparation. 1 ounce of dried flour heads added to a pint of sugar water, simple sugar, boil and strain. Now, if you don't want to use sugar water, you want to use honey or something else to sweeten it, you can do that. But basically, that's making a syrup. How are syrups made? How is garlic syrup? How is a cough syrup? How are syrups traditionally made? This is how syrups were traditionally made. Take that freely as needed. And then, yeah, here's your first assignment though, is to share something of what you've learned.
Excuse me, Dr. Brown. I don't know if it's my view or your view, but the information is out of the panel.
I can't see your view, but you know what? Just hit me in chat since we're recording. Okay. And okay. So share with what you've learned with at least 3 people, study, go over the Latin name and the common name and the medicinal benefits of the herb. And then, okay, I want to share the information is presented here is for educational and informational purposes only. It's not intended to diagnose, treat, cure, or prevent any disease. Not a substitute for professional medical advice, diagnosis, or treatment. Always consult your physician or other qualified health provider with any questions you may have regarding a medical condition. Holistic Training Institute, we make every effort to ensure that the information shared is accurate and up to date, but make no representations or warranties, etc. In other words, I'll never tell you not to consult your doctor for any, especially for any health condition. Be very aware of you're responsible for your health. And this also applies to your loved ones, etc. We do not diagnose, we do not prescribe. Okay.